Hi there. Thank you for joining us for week 2 of our Physical Therapy Month Facebook Talks. Today we're going to be talking with Dr. Marc Forrest about why he chose a profession in physical therapy, some of his favorite things about working at HROSM, and just general questions. So if you have any questions at all during the live, feel free to comment them, and let's take it away. All right, let me get you situated here. Apologies. Okay. How are you doing, Dr. Forrest?
Hi, Sarah.
Hi.
Hi, Facebook world.
Awesome. So I guess I'll just start off with tell us a little bit about yourself.
Well, I'm Marc Forrest. I'm a physical therapist here with Hampton Roads Orthopedics and Sports Medicine. I'm the director of physical therapy here, and I've worked here for almost 20 years. So, folks on Facebook, if you've ever been to our clinic, chances are you've either I've seen you or you have seen me around our PT clinic since 2002. So.
Awesome. And where did you go to college to become a physical therapist? Did you know that that was what you wanted to do, or?
Yeah, kinda. I knew coming out of high school I wanted to do something in medicine, sports medicine, orthopedics. It all kind of spoke to me. You know, I played football in high school, like pretty much every sport that I could play when I was in high school. I tried to play basketball, and so I ended up going to the University of Virginia, where I got a bachelor's in biology, and I was on a pre-med track, and really kind of got interested in physical therapy. After my second year, I played rugby for UVA for 4 years, and in the beginning of my second year, I tore my ACL, and going through the surgery and the rehab for that, actually that's when I was first exposed to Hampton Roads Orthopedics, because when I came back that summer, I had to get an ACL reconstruction, and I met this new doctor here whose name was Anthony Carter, who did, it was back in 1997, who did my ACL reconstruction. And then after going through the rehab for my ACL, that's when I was first exposed to physical therapy as a profession, and I really looked at it, and it kind of spoke to me that this is the niche that I want to be in, and definitely in orthopedics is what I wanted to do. So after finishing at UVA, I was lucky enough to be accepted into Medical College of Virginia's physical therapy school, where I got my Master's of Science degree in 2002. Also met my wife there, and who's also a physical therapist at a competing company. Yes.
That's so
and
cute.
So I started practicing in 2002 with my Master's of Science degree in physical therapy, which is all you needed at the time. But a couple of years ago, I went back and did a not transfer degree, but basically got my doctorate in physical therapy in I think it was early 2019, pre-pandemic. So.
Oh, wow. Cool. And then once you got your doctorate degree, like, do you have anything else that you might want to achieve after that, or would you ever consider going back to school, or?
I would go back to school, but my next degree would be probably something more business related or something like that, or even some kind of law degree. But I'm really not looking forward to going back to. I've had 3 degrees is good, but one of the things I studied the hardest for wasn't even my doctorate of physical therapy. I have my orthopedic clinical specialty through the American Board of Physical Therapy Specialties, and that was a very intense specialization to be board certified in orthopedics. I think of all of the physical therapists that take that board certification, I think the pass rate is only like 10 to 20% of anybody who takes it. So I I studied extraordinarily hard, harder than I've ever studied in my life, but it was a fantastic experience now that it's all over, but it really kind of hones in your skill set and your knowledge base in orthopedics.
That's awesome. Do a little
Yeah,
pat,
yeah,
you know?
yeah.
Got a certified
I was excited.
certified physical therapist right here. Everyone should come here. You answered a couple questions that I already had written down about sports and high school and what drew you to choosing physical therapy as a profession. So my next question is, do you have any specialties, or are there any, specific patients that you like to rehab?
Absolutely. Of course, I always love I have a soft spot in my heart for all the sports injuries that we have, especially ones like mine. I like to see folks when they first come in after having an ACL reconstruction and say, hey, I had this too. Different injuries that you can kind of sympathize with the patient and make that connection. And number one, tell them that it's going to be okay, because 99.9% of the time, everybody that we see is gonna get better, either through therapy, or if they've had surgery, through the post-operative period, and kind of helping to guide folks through what's a tough time. I mean, everybody who we see for the most part is having pain, having trouble with mobility, not able to do the things that they want to do in life. And so it's really rewarding to see, and help people, go from a point in their life where they, aren't feeling their best or able to do their best, and trying to regain some function and abilities that they may not even know that they were still capable of, especially with the folks that we see after joint replacement. Sometimes people's hips, shoulders, or knees, which are the joint replacements we typically see, they're in such bad shape before the surgery that once they get that new joint or that new prosthetic put in, that they are able to use their hip or their knee or their shoulder more so than they've been able to do in years, and so they're able to get back to doing those things that they just haven't been able to do in sometimes 5 or 10 years.
And aside from sports injuries or surgical procedures, like what kind of patients or people do we tend to see here for physical therapy?
It kind of runs the gambit. We see, not so many pediatric patients. Usually, those folks go to more, I would say kids in middle school or younger, maybe even elementary school. They tend to go to more of a pediatric specialized therapist. But once they're, the younger patients are able to follow directions relatively well. In middle school, high school, we'll start to see the younger folks who have sports injuries or overuse types injuries there. And then, it goes through, the folks that are, currently in their working years. We see a lot of overuse injuries. Some different professions, have some troubles with back pain or shoulder pain. But then all the way up to, the older population who may be, having some issues with arthritis or degenerative joint disease in their back. A lot of times we can help to fix that. Even though the x-rays don't look that great, a lot of times we can, it's not the x-ray that we treat, it's the pain. And so we can eliminate the pain, even though the x-ray may look a little rough. We can work on trying to get people feeling better with either arthritis pain or after joint replacement or anything like that.
Awesome. And how long, I think you might have touched on this earlier, but how long have you been working here at Hampton Roads Orthopedics?
I've been here for almost 20 years, so
Wow.
It's been I can't believe it's been 20 years. It's been great. We have such a great group in physical therapy. I've been very fortunate to work with my old mentor, Bill Powers. If people are watching and remember him, they know that we started together in 2002, and he retired in 2019, but we all miss him. Also, been very blessed to work with Dr. Chad Carlson, Dr. Stacy C., Shannon Jackson, and Brandon Arendis. All are just such a that's our current group of therapists. We just have such a excellent group, and we couldn't ask for a better group of doctors and a better company, honestly, to work for. It's been fantastic.
And my last question for you today is, what do you like the most about working here? Do you have like a favorite thing about HROSM, or what do you love about working here?
I would say, like I said, the people, like both our patients. We have a lighthearted, kind of clinic where we like to laugh and joke and just be playful with our patients while we're doing all the rehab and physical therapy to make people feel better. But we have a great group of doctors, a great staff, the whole company staff. We just everybody seems to get along. I truly look forward to coming to work every day, just to see our patients, to see our staff, and just see what the next day brings, because every day is a new day, and we definitely you never know what is the next patient who's walking through the door, what's the next diagnosis. For when you think after 20 years of you've seen every orthopedic injury out there, then you go to the next day and there's something new. So you never know, and that's what makes this job great. So.
Yeah, I agree. I think every day is not the same, so definitely I enjoy working here a lot too, because you always have something new, something different to do.
Absolutely.
Well, thank you so much for your time today. I'm gonna awkwardly turn the camera around. Thank you. And thank you to everyone who tuned in to watch us for our second week of physical therapy talks. Next week, we will be interviewing Dr. Stacy C. She will also be talking about just why she chose to become a physical therapist and some of what her favorite things are about working here, so we hope that you'll join us. Also, if you need help recovering from an accident, an injury, or surgery, we hope that you will choose Hampton Roads Orthopedics as your physical therapist or orthopedic practice of choice. But as always, we hope to see you again next week, and if you have any questions, feel free to comment or visit our website at www.hrosm.com. Thank you so much. I hope you all have a great weekend.